coming to its Bhedana action, Sharangara Samhita, while defining the Bhedana action, he clearly gives an example of Katuki only. And so Vedana action can be roughly translated into, say, a laxative or purgative action. So if you compare say in modern terms, laxative or purgative action, so we have other herbs such as Haritaki, Trivrat, castor oil, Croton tiglium, or we have Jayapala. So compared to these, where would Kutki stand, sir?
Katuki is definitely, we can take it as a very good bowel cleanser. We cannot take it, keep it this thing in any other way. See, very clearly, Sharandara has said, Haritaki as Anulomana, whereas Katuki as Bedhana, then Trivrit as Sukha Virechana, whereas Jayapala as Tivra Virechana. One is a mild and regular purgative, or you can take it as a defined time being a laxative, whereas but Trivrit Acharya says that it's a Sukha Virechaka. Sukha Virechaka should not cause any disturbance and it should give out very clearly the Virechana effect. But we do remember and we do use particularly Trivrit Lehya for giving Virechana purposes. So it does Virechana in Vegas will come. It is not only simply Sukha Virechika. If it is given in an overdose, it may even produce a very good purgation. But when compared to the dosage pattern and the result outcome, particularly the Jayapala, which is a very stronger one compared among all these four. Haritaki is a milder form and it is Anulomana, which can be taken regularly, but of course also causes watery motions many a times. But Katuki is one drug which is can be used in all conditions, whether it is a Baddhamala or Abaddhamala or whatever it may be, Amayuga or Niramamala, all these conditions, it will clear the bowels. So that's the reason Katuki is one of the important drug. It can be taken on a daily basis also in a small doses, just like Haritaki. Because Haritaki is also, it is Pathyanam. Haritaki is very good for the Patha or the Srotasas inside the body. Whereas Trivrit is usually a Sukhaviraj in Acharyas, but it is usually, generally we use them in particularly where there is a planned Virechana procedures are done. In those conditions, Trivrit Leha is used. We don't use Trivrit on a daily routine basis. Similarly, the drastic purgations are very, very required, like in ascites and such type of Jatodaka avastha, where there is a free fluid in the abdomen or peritoneal cavity, then we need to go for a drastic Virechana type of things, or where there is a Shotha, and such conditions, we use Croton tiglium, that is Jayapal, the more stronger one. So in that order, Haritaki is a milder form, Katuki is in the somewhat same nearer to that. Next is what do you call Trivrit, and the last one is the drastic one is Jayapala, stronger one.
Thank you there. So does use of Katuki for the Bhedana or the laxative purgative effect, does it cause any twitching effect on the intestines and a little bit abdominal pain?
Usually we don't come across, but of course in some Purusha, if it is there, then there may be chances of that gripping type of pain may occur. But generally we don't come across such type of problems. But occasionally if it is a Sukumara Purusha, then there may be chances.
Yeah. What could be the dose for it to be used, say, for mild Virechana purpose and for for the normal dosha shamana purpose?
See, it's usually within 1 gram. For the general routine purposes, we use it. Where our intention is to have a stronger bowel evacuation, and if the person's costa is a Krura costa, then in that condition, we will go for up to 3 grams. 3 grams of Katuki Churna, we will take it.
So it is not like any other like very safer herbs where we usually use it for like usually general dose of churnas is kept as like 3 to 5 grams, wherein it is used in a lesser dose.
Yes, definitely. Definitely it should be lesser dose and a longer duration. That gives a very wonderful results.